So hi, I'm Brianna. I'm one of the chiropractors here at Move to Move, and today we're going to be talking about pelvic floor and abdominal bracing and all things to do with pregnancy. Okay, so we're going to go through just a brief few exercises not to do during pregnancy, because I often find if you're used to any sort of exercise before you're pregnant, you should be continuing to do your regular exercise. We're usually not recommending you to add anything new into your exercise routine that you've never done before, but unless it's a contact sport or a risky sport, and you're not a high-risk pregnancy, you've been cleared for exercise, you should continue doing what you're already used to, and you may have to modify or scale it back a bit, but you're supposed to be very active still during pregnancy. But there are a few strength-based exercises or positions that we try to avoid during pregnancy. The first one is having the glutes above the level of the heart. So even if you take your legs and tuck them in and hold, we tell pregnant mothers to try and avoid this because it can cause something called an air embolism, where air can go up towards the heart or towards the lungs. So this would be what we consider more of an unsafe posture for pregnancy. It may feel good, especially if you're getting sacrum or pelvic pain, but try to avoid this one. The other thing we don't want to be doing is the back-sided glute bridge. So you can demonstrate that, feet flat. And again, when we're lifting our glutes above our heart level, there's risk for air embolism with that. So avoid those ones. You can do other sorts of planks, side planks, front planks if you're feeling okay with them, but the back-sided plank is probably a no-go for pregnancy. Another one we don't want to do if you're having a lot of back-sided or pelvic pain is any sort of double-legged abdominal exercises. So these slow leg lowers and leg raises. You can see even with Olivia, who's extremely strong, she's shaking through her abs. She's using her core very, very intensely there. And if we're gonna have that bit of diastasis recti, we don't wanna further start some expansion there. So even if you do the hold, it's still probably not enough for how intense that exercise is. So we'll avoid those ones. The other one we're gonna avoid is, again, if you have back-sided pelvic pain, is a lot of the just standing on one leg. And so if you're standing on one leg, if you're not completely stable there, you're kind of shifting into your hips, into your pelvis. It can cause some shearing on the backside, and so that can cause women to become uncomfortable and to start their sacrum hurting more. So doing things this way, even kind of the side ones, either standing or the side ones, the fire hydrants, we don't want to do those. Again, especially if you don't do them properly. A lot of times we're doing things like this, and then you're starting to shear through the pelvis.